So I'm a researcher of the University of Paraná in Brazil. I'm the vice chair of the Pharmacy Practice Research SIG. I'm also an HR consultant and scientific advisor and member of the National Group of Health Technology Assessment in Brazil. And I'm also a member of the editorial board of the Pharmacy Practice Journal.
Excuse me, Fernanda, you are not sharing your screen. We are seeing you, but not your.
Okay.
We're seeing your image, but not your screen.
Sorry. So let's maybe now.
Now we see.
Thank you very much. So just some hands up before starting. Please participate in our discussion during this workshop. The workshop is being recorded and will be available on the FIP website. Also use the chat to introduce yourself for context exchange and for ask questions. We will also have some live pool participation using this Slido app. So it's easy to use and you can also start now with one of our first questions to know where are you from. So please use your telephone to scan the QR code or join at the slido.com using the code on the screen. So let's wait a few minutes for people to vote on our first question, or where are you from? So we already have questions like from people from Europe, 100%. Also Asian Pacific and Africa. It's good to know that we have a little bit from everywhere here in our workshop. So just scan the QR code on the screen or join in another tab of your computer at the Slido website. Okay, so we have around 57% of people from Asian Pacific, around 1/3 from Europe, 10% from Africa, and 5% from North America. Moving on to our next question, what are your interests in this workshop? So are you choose to select to participate this workshop with us, to learn about the guidelines for conduction and reporting systematic reviews, to update your knowledge about this type of guidelines, to learn about, to discuss the challenge related to reproducibility science, or others? Let's wait a little bit for people to vote. Okay, so we can see here that most of you already know how to perform a report systematic review and meta-analysis. So you are aware of the guidelines that already exist and want to update your knowledge on this topic. Also, there are 1/3 of people that want to network with researchers and colleagues to share similar interests, and 40% that want to learn more about this type of guidelines. Our last question before starting this workshop is, have you already performed or participate in the conduction and reporting of a systematic review with meta-analysis? Yes, and by yes, you always follow a guidelines or statements such as Prisma. No, never, or yes, but no international guidelines are followed on your research group. Okay, we have here interesting results. So half of the participants always use some guidelines such as Prisma to perform a systematic review. So they already perform one, but half of the participants never performed a systematic review in practice. So this is important for us to conduct this kind of workshop and to integrate our knowledge with your expectations. So for today's program on systematic review and meta-analysis and overview of the Prisma statement, this topic is important because decisions related to patients' value and care should be carefully made by following a process of integration of the best existing evidence, clinical experience, and patients' preferences. Evidence and recommendation generation should be grounded on high-quality study and well-designed and reported systematic reviews and meta-analysis. They are more important now than ever because of the unprecedented pressure for action and the large number of people affected by healthcare decisions. So this workshop aims to present the state of art of systematic reviews and meta-analysis on the biomedical field, highlight the challenges for performing reproducible and transparent systematic reviews and meta-analysis, review the main change of the new Prisma that was published in 2020 compared to the previous version, and discuss our roles as researchers in the healthcare professionals in erasing science reliability. So it's my great pleasure to present to you our speaker, Fernando Fernandes Limos, professor at the Laboratory of Pharmacology at the Faculty of Pharmacy, University of Porto, Portugal. He's a senior researcher of the Health Information System Electronic Health Records at the Synthesis Center for Health Technology and Service Research at the University of Porto in Portugal. He's also the leader of the Research Methodology Focus Group of our SIG, and he is the editor-in-chief of the Pharmacy Practice, the journal. So welcome, Professor Fernando. It's a pleasure to have you here and to share you with our knowledge. I'll stop sharing my screen for you to share yours.
Okay, can you see my slides?
Yes.
So thank you very much. I'll start from here. First of all, thank you very much for your kind words, and thank you very much to the SIG group to allow me the opportunity to run a workshop. This is not going to be a real workshop because we have very limited time to perform the workshop, but it's about a topic that I love and I've been working for some years. You, Fernanda, have omitted something that is very important in my CV, and this is the fact that I have the privilege of being your supervisor in both of your PhD degrees.
That's true.
So, so thank you very much for the opportunity also to supervise your two PhDs. So let's talk about systematic reviews. We have seen that about half of the people attending to this workshop have already performed systematic reviews, but half of them have not or have made without following a guideline. You all know probably the pyramid of the Oxford group of quality of evidence. But many people, when look at this pyramid, see just a rank order of study designs. And that's true. It's a rank order of the study designs regarding of their quality of evidence. But there's some other things that are very important in this pyramid. One of these things are the two gaps that the pyramid have. So these two gaps are really important, and we tend to omit them. Well, the first gap separates, I'm talking about this one, separates what's not evidence from the evidence. I would say that below this gap, nothing is evidence. This is the expert opinion. This is this panel, the consensus panels that we make among experts, and that's very interesting, very relevant. That's not evidence. So only above this gap, we can start considering evidence. We have a second block here of study designs between the two gaps that have some evidence, but have some particular characteristic that we should take into account. Regardless the quality of these study designs here, all of them are single study reports. So all of them can have bias. They have bias, no can, they have for sure biases. And these biases can be known or unknown biases. So this is what we call unfiltered information. Making decisions based on these kind of studies may be dangerous because we don't know the impact of the bias they have on the decision we are making. So that's why we created a second gap here, which is the difference between single studies or filter information, appraise studies. The top of this pyramid are the systematic reviews that we're going to talk about in this morning. So what's a systematic review and why do we have systematic reviews? Okay, this is nothing new, and I have to say that. If you see the first box, the red box that we created there, it's a reference from 1904. This is a more than 100 years old reference. And it's when Carl Pilson, a mathematician and a statistician from the UK, was studying inference in statistics and effect sizes. And he explained that the vast majority of the studies that we do are too small to allow a definite opinion of the effect. At that time, Pearson also explained that, or stated that using just one study, no matter the quality of that study, will never be sufficient to explain the nature of a phenomenon. So that's why we need to compile different studies into one study, and this is what we call a systematic review. This is the definition, and here is the definition that the group of Dagalman provided, and said that a systematic review is the set of strategies that we use to limit the bias in assembly, to critically appraise, and to synthesize all the relevant studies. I would like, and I do that when I teach this to my students, to capitalize these all relevant studies, because this is crucial. They explain in the definition that meta-analysis may be with or without, sorry, the systematic reviews may be with or without a meta-analysis. So what's that meta-analysis thing? Well, a meta-analysis is not a type of study, is not a study design. Meta-analysis is simply a statistical calculation. You can perform meta-analysis as a statistical calculation upon the results of a systematic review to obtain a pool effect size of these effect sizes of these systematic reviews, of the studies of these systematic reviews. But you can also perform meta-analysis in different things. So please don't consider a meta-analysis a kind of systematic review. That's not correct. That's why I recommend a slight modification of the first item of the Prisma that we're going to talk about today. The name should not be systematic review and meta-analysis. I would like to say, I prefer saying systematic review with meta-analysis, because remember, meta-analysis can be, you can have, for instance, when you have an experiment with animals in a lab, you can have different experiments for the same drug, and you can make a meta-analysis of your experiments. So you don't need a systematic review to make meta-analysis, and you don't need meta-analysis to make a systematic review. So meta-analysis is a calculation that you can perform upon the results of your systematic review. Okay. So let's see, we know a lot about systematic reviews. There's a lot of information. There's a lot of training in this area, but we are failing. And I have to say that we are failing. This is not my analysis, our analysis. This is an analysis for one of the best researchers in this field, is Ioannidis. He's making a lot of work in meta-research, which is the research upon the research. So we are researching on research. Ioannidis stated that only 3% of the systematic reviews have a clinical and a scientific meaning. it's amazing. Only 3% of them, 27% are redundant, so we could skip them, we could ignore them. 20% have methodological flaws, serious methodological flaws that invalidate their conclusions. 20% are unpublished. 17% are decent. They call decent, they mean they are correctly performed, but are completely useless. And 13% produce misleading conclusions. This is terrible. This was a study, a small study that the Johannes performed some years ago using different kinds of systematic reviews. What happens here? Our research group has been working in this area for some years, and we have been publishing methodological analysis of systematic reviews. But specifically in the recent years, we have been working in pharmacy services. Our conclusions are quite similar to those provided by Johannes. They call, and that's not a word that I invented, they call, the group of Johannes, they call that we produce a lot of waste. They say that we produce a lot of waste because we are producing many meta-analyses very quickly, useless. Let me think, why is this happening? Well, I think the publication speed is a problem. Many researchers are trying now to increase the publication speed. And I'm more close to that movement that it's called slow science movement. Let's think before publishing. Let's think a lot before publishing. Let me give you an example. We are about 1 year and a half under the COVID era, the COVID pandemics. In this 1 year and a half, if you go to PubMed and search for COVID-19 in the title and systematic review in the title, which is a very narrow, very specific search strategy, although this is too specific a search strategy, you retrieve 1,732 results. So in 1 year and a half, since the beginning, since the inception of this COVID pandemics, we have 1,700 systematic reviews published. This creates a problem in such an amount of literature, where to find reliable information, how to differentiate what is really updated, what is obsolete, and how we can apply this amount of evidence. I wouldn't call that evidence, that enormous amount of papers into practice. Let me show you an example of what is, in my opinion, extreme in this process of publishing too many systematic reviews. This is the oldest one that I found in this topic. I'm not sure it's the oldest one existing, but this is the title is quite surprising. Potential intervention for novel coronavirus in China, systematic review. And be aware that at that time, there was not the name COVID invented yet, and they called that novel coronavirus. It was published in February 13, 2020, and talk about the potential interventions in that COVID. In my opinion, this is a very immature systematic review, because it's impossible to publish in the February 13 something relevant about COVID, just few days after the worldwide recognition of the disease. So this is a big problem, and we should not fall into that error, I think. In fact, we are talking about reproducibility of the research. This is something that we extracted from the Nature group, and all the journals, all the researchers are really concerned about what we call reproducibility. Something that we should all have in mind is that sciences move by corroboration. This means that we research something, we raise an hypothesis, we test the hypothesis, and we publish that thing, accepting or rejecting the hypothesis. The next researcher should build upon our research, but the first thing that the next researcher should do is confirming our results in his or her environment. So he should corroborate our results and build upon them. If they cannot replicate our results, we've got a problem. So nature says that we are producing waste. They also say waste. And why? Because many reasons. The increasing level of self-scrutiny, that should not be a real reason. The complexity of the experiments, well, we are performing poor experiments because they are complex. That should not be. And the most important one, the pressure on the researchers to publish and to keep publishing. So what they recommend, what they say in this analysis is that journals, scientists, institutions, and funders are responsible for this lack of reproducibility and should have an active part in tackling this big issue. Why is this especially important in systematic reviews? Okay, remember the pyramid that we show in the beginning of this presentation. This group of colleagues from said something that it's quite relevant. Okay, they agree that the top of the pyramid are the systematic review and the meta-analysis, but they present them, and that's absolutely true, not only as the top of the pyramid, but also as the magnifier that you have to use to apprise, to deeply analyze, and to criticize the designs, the studies of all that lower stages of evidence. They say also that the limits that the Oxford pyramid draw very, very straight, very clear, are not so clear. And in many occasions, a good case control study, well matched, well analyzed, can be better than some cohort studies, or a good cohort study with a lot of confounding adjustment and all these things could be better than some randomized control trials. So the limits are not so well designed. This is why the researcher that performs a systematic review should deeply analyze the quality and the characteristics of these researchers. This means that the systematic reviewer is someone that should be very aware of the field that he or she is analyzing, should be an expert in that field. That leads me to an opinion, and this is an opinion that we can discuss at the end of this session, an opinion that many supervisors and many PhD students think of creating a systematic review, of conducting a systematic review as the beginning of their PhD in order to get insight in the topic of their PhD. In my opinion, this is a wrong approach, because at the beginning of a PhD, the student have no sufficient knowledge of the topic he or she is going to apprise. So it's not the best moment to perform a systematic review. My opinion is that the systematic review should be almost at the end of the PhD path, when the student has a very deep knowledge of the topic, has been studying for years, and is the best situation that he or she can perform a systematic review. This is an opinion that we can discuss at the end. So let's see how we should conduct and report a systematic review. Okay, guidelines are to help us, not to complicate our lives. And we have very good guidelines, not only for systematic reviews, we have very good guidelines for reporting and conducting all the studies. So I would strongly recommend you to use a guideline as part of your protocol. I mean, you should create your protocol considering the guideline that you will use to report that study, because it helps you to consider what's important since the very beginning. So please, if you are going to perform a randomized control trial, have a careful read of the consort statement, or for an observational study, have STROB should be your guide. In systematic reviews, we have two guidelines, one for conducting, which is the AMSTAR. We are not going to talk about the AMSTAR today, and the Prisma statement, which is the guideline for reporting the systematic review. Many people says, okay, I know the Prisma guideline and I'm using the Prisma guideline. Okay, that's not correct. In our analysis, we found, for instance, in this paper, we found that only 36% mentioned in following Prisma statements. This is for network meta-analysis, a different kind of meta-analysis. So only 36%. But when you see those that report using the Prisma, they fulfill only 23 points out of 32 in the NMA, and in this other analysis, 24 out of the 27. So they report using Prisma, but they don't completely use Prisma. Our intention is not only should mention that you use Prisma, you should actually use Prisma. Okay, what's Prisma? Well, Prisma stands for Preferred Reporting Items for Systematic Review and Meta-Analysis. So this is very clear. It's a reporting guideline. It's not a conducting guideline. This is how your systematic review should be reported. But if you use Prisma when you create a protocol of your systematic review, it will help you to know what you have to report at the end. So it will help you to create your protocol, and it will help you to avoid falling into some typical errors. It's Prisma is the minimum set of items. And when we say minimum, we say really minimum. This means that you should attend to all, absolutely all the items of Prisma. You can report more things than the Prisma, but at least the items included in Prisma, all of them should be reported. It's a matter of fact that Prisma is more focused on reviews, systematic reviews, reporting the effects of interventions, but it's not exclusive to report the effects of intervention. Can also be used, to report other types of systematic reviews like prevalence or diagnosis or prognosis systematic reviews. So you can access the Prisma statement going through the Equator network, the previous slide, or going directly to prismastatement.org, and you have all the information there. Who should use Prisma statement? Well, first of all, as I mentioned, authors, researchers should use Prisma. Not only when they are, as I told you, not only when you are writing the results of the report of the systematic review, the article of the systematic review, I recommend you using Prisma since the very beginning, since you are creating, when you are creating the protocol of your systematic review. But also important, peer reviewers and editors should use the Prisma statement just to confirm that everything that should be reported is really reported. That's why increasingly many journals are asking to submit the Prisma checklist. I'm going to show you the checklist in a few minutes. So in the submission process, an increasing number of journals make mandatory that if you are submitting a systematic review, you have to submit as part of the submission process the Prisma checklist. Very brief history of this Prisma statement. Well, we could say that the Prisma, or the need of a guideline to report systematic review, starts in the 80s. And remember that the systematic reviews were not very common in 1980s, that decade. At that time, reviews were mainly narrative reviews. And this was one of the studies that Cynthia Mulrow that raised the awareness that these narrative reviews were a kind of anarchic reviews. Everyone reported what wanted to report, no clear methods were in those systematic reviews. So one of the conclusions of Cynthia Mulrow was that the reviews should be performed more systematically, kind of start to the need of systematic reviews. The first Prisma statement was published in 2009. It was not 1 year work, was more than 1 year work. Was published first in 2009. During 2000 was reviewed and was published very recently in 2021. For this year was published the new version of the Prisma. The author said that it reflects more than a decade of experience using the Prisma, the first version of the Prisma. As I told you, it consists in a checklist and a flow diagram, a flow chart. Many people know the flow diagram. Many people know, and many people use the flow diagram. And many people ignore the checklist. In my opinion, they are equally important. I would say, I don't want to be too passionate in this, but I would say that the checklist is at least as important as the flow diagram. So please do not ignore the checklist. That could be the first recommendation that I would say you. Please use both of them, but print the checklist and have in front of you when you create the protocol. As you're going to see today, the new version of the Prisma is quite more complex than the Prisma 2009, and that's why the Prisma group, created what they call Prisma 2020 Explanation and Elaboration Document. It's a must. You need it. We all need it. Although we work with Prisma for many years, the new version is quite complicated. And if we want to have a standard document, we have to read the instructions, which are written here in the Explanation and Elaboration Document. Some weak point, in my opinion, of the Prisma as a whole is this topic about the extensions. Well, Prisma is not a unique checklist and flow diagram. They have what they call extensions. Some of these extensions are reasonable because there are different kinds of systematic reviews. For instance, they have a different Prisma statement when you are writing the protocol to check what are the minimum elements that should be in the protocol of a systematic review. They have also a different Prisma for scoping reviews. Be careful when we talk about scoping reviews. We will probably have that research soon. We call scoping reviews as many things that are not real scoping reviews. And scoping review is a systematic review with a different aim. Instead of answering a research question, the final goal of a scoping review is to produce a concept map. But it's a systematic review. Don't forget of that. But apart from this extension that, in my opinion, makes sense, Prisma has some other extensions that I don't like. For instance, if you go to the main Prisma, they tell you that one of the items is that you have to perform an abstract with a given conditions. Well, they have a different extension for abstract, Prisma abstract. Fortunately, the new Prisma includes all this into one document, but they don't make the same thing with the Prisma search, and they have a different Prisma search, a different checklist for the how you should report the systematic search of your systematic review, instead of being in the same document. My opinion, there should be only one document for all the guidance on reporting systematic reviews. Something that is nice from them is that to encourage the dissemination of the Prisma, this group always publish the Prisma statement in different journals, so you can have access to different journals. You can cite any of these journals. So it's trying to facilitate the dissemination of this thing. Okay, what are the characteristics of this new 2020 Prisma? It still has 27 items. I don't agree with that. I mean, that's what they say, but I don't agree with that. Because when I present you in a couple of slides the checklist, you will see that there are 27 numbers, but not 27 items, because some of these items are subdivided in 13A, 13B, 13C, 13F. So in fact, there are not 27 items. There are 41 items in the new Prisma. That's not a problem. I mean, it's not a problem for me, but I don't like the idea that they still have the same 27 items at the beginning, because that's not true. And even worse, the item number 13 is not equivalent to item 13 in the previous version. So I would say new Prisma has 41 items. They revise these items to increase the clarity. That's true. That's true, because the previous Prisma was kind of subjective, have a lot of subjective interpretations. So now they try to avoid these subjective interpretations in order to produce more objective judgment. So what changed? Many things, quite a lot of things. For instance, they have extra guidance on how to synthesize, not how to synthesize, how to report the synthesis, and how to report the assessment of certainty of the body of evidence. They have also guidance on how to report the use of automation tools that are increasingly being used for systematic reviews, or how to report the competing interest of the authors of the review, or how should make available the raw data that you use on the systematic review. The 2020 has also an updated flow chart. They modify the well-known Prisma flow chart into a new, well, it's not a new, and that's something that I also don't like too much. In fact, there are 4 different new flow charts. The first thing they have done with the flow chart is dividing them into 2 blocks of flow charts, 2 groups of, and that's necessary, and we need that, because we are increasing the number of review updates. A few years ago, we were very interested in producing a lot of new systematic reviews. Some of them became obsolete, and we have to update them. So we need a specific flow chart for review updates, different from the flow chart of systematic reviews, new systematic reviews. But they complicated a bit more this thing, creating 2 different flow charts for each of these 2 groups, considering if you use or not unpublished literature. This is very controversial. We can talk about in the discussion later on. I'm clearly against the use of unpublished literature. And just to give you an idea, this is a way to escape many things that we have done during more than 1 century of advancement in publication. Unpublished literature has not been peer-reviewed. Unpublished literature has not undergone a registered process that we use in publish. Unpublished literature can be omitted or used upon you. It depends on you. So it can completely bias a systematic review. That my opinion is that we should never use unpublished literature. What we should do is publish that unpublished literature and then use it in systematic review. So due to this complexity they created with the process, they created an online application to help you to follow the checklist and to create these flowcharts. Let me show you this Prisma 2020, which is very similar in the layout to the Prisma 2009, sorry. But if you see here, you have a 10A, 10B, and you have here a 13A, 13B, 13C, till 13F. So although you have 27 numbers, you have 41 items in the Prisma, and they classify them quite similar to the previous Prisma. Fernando is going to enter in the details what changed now. The flow charts, the flow diagrams. Okay, as I told you, there are not only one flow chart as we had before. We have now 4 different flow charts. And these flow charts, in my opinion, became a bit too complex. Well, the left-hand side, you have the typical flow chart that is now recommended for a new systematic review and when you are not using not unpublished literature. So you know this flow chart is quite simple. When you are using unpublished literature, you have to use this other one that has the same layout that this one here, but that's here the origin of that unpublished literature. My opinion, although I stated that I'm not in favor of using unpublished literature. If you want to use the unpublished literature, you can put here the origin of the unpublished literature. So this part is, in my opinion, unnecessary. And these are the other 2 flow charts where you have the typical flow chart for the updating the review, and you add the records from the old review that you are updating. So I agree with this one, and you have the similar one when you're using unpublished literature. As you can see, this is quite complex to publish in a paper. It's too much information. It's in my opinion, it's unnecessary. So to be able to or to facilitate creating this complex flow chart, they created this tool where you can fill the numbers here and they appear automatically in your flow chart. So I'm going to pass the floor now to Fernanda, that are going to enter in the details of the items that change, and then we go to the discussion and we can have questions, but also your opinions, your thoughts, and your participation. Fernanda, I will stop sharing my screen.
Thank you very much, Fernando. Thank you again for the nice explanation about the Prisma, and it's again an honor to be here with you sharing this workshop. So now let me share my screen again. And let's move forward on the change of the new Prisma. So let me see. I see that we will have already some questions on the chat box, but I believe that we can answer that after the presentation, because some of them I think I will explain now during my presentation. So, as Fernando already told you, the current version has some difference compared to the previous one. Here I highlighted in the slide some of them. So now we have an abstract reporting checklist, so it's another extension of the Prisma. They also changed some parts of the meta sections, the results sections, and now there's an important topics that authors should add, that is to declare any competing interest and to inform how they publish or is the raw data. So in the next slides, I will talk about some of these points and we can discuss further on during the networking event and the question and answers topics. So about the abstract reporting checklist, this is the model of this new extension of the Prisma. This was developed by the Prisma group because they wanted that authors also report in a standardized manner the abstract of their articles. This is important because a recent study showed that still some studies, they do not identify their research as systematic reviews or meta-analyses in the title, and this is quite mandatory. Another research study showed that around 4 items of the abstracts, such as objectives, results, main outcomes, and interpretation, are not properly reported in around 25% of abstracts. And this point is also important that the registration status is reported in less than 5% of all systematic reviews abstract. So we are saying that around 95% of studies do not report the status of their study of the published protocols. Even though after publishing the abstract reporting checklist, a recent study showed that the median adherence to this extension is still of around 45%. So we know that this statement is new, it was published last year, but still we have to adapt ourselves and our research to fulfill all the requirements, all the items that the Prisma are asking us. So regarding the method section, now the Prisma asks authors to report the protocol and the registration. This topic was already covered by Fernando in a couple of slides back, but it's important that systematic reviews protocols are published because this kind of documentation consider a priori methods and analysis. It can guide reviewers and prevent arbitrary decisions. And if published, it intends to reduce some biases. And as well, it can facilitate the detection of selective reporting. The Prisma has also an extension, so it's the Prisma P or Prisma Protocol that help authors, guide authors on how to perform and write and report their protocols on systematic reviews. And we also have platforms such as Prospero that is useful for us to publish our research. This is important because around 20% of studies lack on reporting the registration status, or they do not provide a protocol or information on the available data. So this is the Prospero platform. I'm aware that some of you know it. The Prospero is an international prospect register of systematic reviews. And here you can search from others Prospero reviews that are already published. So you can see other studies and prevent redundant literature on the topic. And you can register a new review. So Prisma recommends registering systematic reviews, and Prospero, it's a nice place to do it. And it's nice to know that Cochrane protocols are automatically uploaded onto Prospero. Another topic on the Prisma statement, also in method section, is regarding the search strategy. The Prisma statement now say that authors should present full search strategy for all database used during the systematic review. So for authors to present the full searches and also to guide the research question, they can use, for instance, some acronyms, such as PICOs that stand for population, intervention, comparison, outcome, and study design, and other variations such as PALE, SPIDER, and ECLIPSE. Those acronyms, so they can guide the research question, but also the search strategy. This is important because a previous research showed that the frequency of search errors is quite common among systematic reviews. We have a lot of problems regarding the mesh terms. So this is a controlled vocabulary from the PubMed. Also have problems on missing spelling variants, truncation errors, and logical using operate Boolean components. And also because the search strategy is not tailored for other databases. So that is why also, because Prisma now recommends authors to inform all the search strategy used for each database. So what should you know? During our research and the development of the search strategy, we should ask, does the search strategy matches the research question or our acronyms? Are the search concepts clear enough? Are the Boolean or proximity operators used correctly? Are any spelling errors? Are all limits and filter used properly, etc.? Again, on the method section, Prisma states some points about the data items and synthesis methods. So now they require authors to list and define all outcomes for each data were sought, describe any methods required to prepare the data for presentation or synthesis, such as handling missing summary statistics and data conversions, and describe any methods to tabulate or visually display the results, both for individual studies, but also for synthesis. So during this step, authors should have clear in mind how to identify the data elements, how to group them, and the best way to extract information. We also suggest that authors develop and pilot data extraction and forms for the expecting reporting formats, train the data extractors on the agreements of the data that will be extracted, and export and clean data for analysis. Now going back, going to the methods and results section, the Prisma state about the assessment of certainty in the body of evidence. This is quite new, so now it's important to describe any methods used to assess the confidence on the body of evidence of an outcome. So this is different from assessing methodological aspects or risk of bias of individual studies. Here we are focusing on the whole body of evidence. So for this, one of the most used tools is the grade. This tool is the grading of recommendations, assessment, development, and evaluation. It's a quite complex approach, but it's important because it defines the grades of evidence into high, moderate, low, and very low, according to some domains that include the study designs that are in the systematic review, the quality of these studies, the inconsistencies, indirectness, imprecisions, and other factors. This is important because it can guide recommendations that can go from strong to weak, or favor or against an intervention. Again, considering the whole body of evidence. Also in the results section, regarding the result synthesis, Prisma statement says that authors should briefly summarize the characteristics and risk of bias among the studies. This is really important because around 1/3 of systematic reviews that we know fail to report the results of the risk of bias of these studies or the methodological quality assessment. And less than half of them, they do not incorporate the results of the quality assessment in the analysis or in the discussion. And this can guide to these misleading conclusions that Fernando stated in the beginning of the presentation. So there are several tools available for assessing the methodological quality of different studies designed, ranging from preclinical to clinical studies, and also from systematic reviews and meta-analyses. So check on that. The Cochrane collaboration has a lot of validated and standard tools, such as the Hobbings, the Hob, and updated tools that can be used for assessing and reporting the risk of bias of primary studies. And also, don't forget to, besides assessing the risk of bias, also incorporating this data during the discussion of the systematic review. Going now to the part of the meta-analysis. So Fernando stated before that meta-analysis is the statistical component of that can be used together with the systematic review. This is one of the most challenging part of a systematic review, and we still have several issues in the biomedical field. So our research showed that almost 70% of meta-analysis included trials that were not eligible to this kind of study. So they were incorporated wrong studies according to the eligibility criteria. 75% missed eligible trials. All of them contained errors in the dichotomical data extraction that can reflect on the final conclusions. And 31% had difference in the treatment effects between the reported results and then the recalculated summary statistics. And all of that can impact on the conclusions that we have about one intervention. So what Prisma say about the reporting data on the meta-analysis? So the minimum items that should be provided by authors include the studies, so how many studies and the type of studies included, the summary of statistics, the 95% confidence interval, the raw data, the heterogeneity information that is usually assessed by using the IQ index, and subgroup or sensitivity analysis. So this figure on your right is the example provided by Prisma of an ideal meta-analysis with all the items that I mentioned before. So we have here on your figure the studies, the events for one intervention compared to another on the total sample size. You have here the measure, the statistics. So here the risk ratio, the effect, and the effect on numbers. And here the heterogeneity data on this meta-analysis. So this is what Prisma said that authors should always provide for all the meta-analysis conducted. However, what can we do better? We see that meta-analysis is still a complex tool, and we need to report better on that to enhance the replicability and reproducibility of data of science. So our research group recently published an article that is on methodological standards for conducting and reporting meta-analyses, so ensuring the replicability of meta-analysis of pharmacy-led medication review. So what were our group provided? So we come along with several recommendations beyond the Prisma statement for authors to conduct and report a meta-analysis. The first one, they should provide all data used to build the meta-analysis, not only the minimum forest plot that Prisma is asking for. So authors should make available either in the main text or in supplementary materials or in open data platforms, a complete table with all the extracted data that was used to build the meta-analysis. So the number of events of each intervention, the sample size in each group, etc. Second, authors should inform about inputted data. This is a quite common practice, but not all authors inform about that. So authors should inform, together with the raw data on the table that were extracted, which variables were inputted or further recalculated in any manner. Third, authors should inform about the data obtained from different sources. So for instance, contacting with other authors. So if data was obtained by means of contacted primary authors or from unpublished sources, this information, together with the collect primary data and the raw data, should be disclosed. Authors should also perform sensitivity analysis when the inputted data or unpublished data were used, because on that, we will have two different kinds of analysis. So the original analysis with the inputted data and a sensitivity analysis removing or redistributing this inputted data. 5, authors should inform about the statistical method, the models, and the effect size measure that were tested. So they should report all the mathematical methods, for instance, inverse variance, meta-analyses, the models, both random or fixed, and the measures such as risk ratio, odds ratio, and mean difference for each meta-analysis. Further on, authors should provide the complete statistical results for each meta-analysis. So this is quite of what Prisma asked for. So they should report all the results for all the meta-analytical parameters, including effect size values, confidence intervals, the p-value, the heterogeneity parameters, among others. And we also propose authors to inform on additional metrics that include to inform the prediction intervals, the number need to treat, and the fragility index. So reporting prediction intervals, it's important when the heterogeneity in the meta-analysis exists, so it's over 0. This is important because the between studies variability, that is called heterogeneity, is reflected by measures such as tau square or E square. However, the clinical interpretation of this measure is not straightforward. The confidence interval of the effect size measure is also not able to provide an usable information about the variability or forecast future events. That's why the prediction intervals, also called forecast intervals, can better predict the behavior of one randomly select future measurement from the distribution of values, especially when you have high heterogeneity among studies. So the PI, the prediction interval, is always wider than the confidence intervals and allows a more informative conclusion. So for instance, here we have a simple meta-analysis when you have 4 studies with the number of events and number of events on the intervention and control. These are the results on the forest plot. And here we have the diamond or the pooled effect size. And in this case, we can see that there's a significance on the intervention group with a confidence interval ranging for 0.13 to 0.94. However, we have an heterogeneity of almost 100%. When you calculate the prediction interval, we can see that we have a wider confidence interval. And this wider confidence interval across the line of nudity is the prediction interval. So with the prediction interval, we don't have differences between intervention and control. Authors also are encouraged to report the number need to treat. The NNT is valuable in daily practice as an intuitive measure that assists health professionals in select therapeutic interventions, support benefit risk assessment, and help decision makers. So in a simpler way, number need to treat is the number of patients that I needed to treat in order to have one additional benefit or one additional harm. So the higher the number need to treat for an additional benefit, the less effective is the treatment will be. On the opposite, the higher the number need to harm, the safer the treatment will be. So here we have an example for the hospital admission outcome, where we have 4 studies with different numbers need to treat. In study 1, we have a number need to treat of 10. When compared to study 2, where the number is 15, we can conclude that this number of 15 of study 2 shows a less effective treatment. So we still have to treat 50 persons to one of them have a benefit. In this first case, we just need to treat 10 persons for one additional benefit. And in the same way, we can interpret the number needed to harm. Finally, the reporting author should report the fragility index. So this is important because a lot of meta-analysis, the statistical significance can change after modifying some events from 5 or fewer patients. So for instance, in this example, we have here one meta-analysis with 3 studies, and these are the patients on each study. In this meta-analysis, we have a statistical significant difference between intervention and control. And here we have the risk ratio of 0.6. If we change some persons on some studies that have an event to non-event, on vice versa, we can change the statistical significance of the study, so of the meta-analysis. So here it was statistically significant, and after changing one person from non-event to an event and another from another study from event to non-event, we have here non-statistical significant meta-analysis. This means that with 2 changes, we changed the result of the meta-analysis. So the fragility index in here, after 2 changes, will be 2. So the lower the fragility index, the more fragile the meta-analysis will be, because just changing a few patients, we completely change the result of the meta-analysis. So all of these metrics, additional metrics, are also important, and we encourage authors to read on that or learn a little bit more about it, because we have to report and standardize our reporting on this kind of study. So thank you very much for attending this workshop. I think we can now answer your questions. Let's stop sharing my screen.
Okay, Fernanda, I have been compiling a few questions and the participants can add more. Let me put a line here to see where we were at this time. Okay, so I have here several questions, but please feel free to add more questions. Mohamed El Naim asked, thank you, and I have a few questions. What are the parameters used to assess systematic review and meta-analysis as useless? Methodology, publication, citations, journals? Well, first of all, remember, we assess 2 different things in a meta-analysis: the quality of conducting the meta-analysis and the relevance of the topic, or I would say how the topic was approached. I mean, when you perform an analysis, the first thing that you have to ensure is that the methodological process of conducting an analysis is perfect. I'm going to share the screen to show you something about the importance of this that I'm saying. Let me use this slide that Fernanda presented to you to demonstrate something. Let's think in this meta-analysis that we have, I don't know, 10 studies. Let's imagine that this study, for instance, whatever the study is, was a poor study, was not well conducted, was something that shouldn't be published, whatever. But we include it in the meta-analysis. Okay, the problem of having this study, this poor study here, is only affecting 12.5%, because this is the column of the weight. So it would produce a confusion in my effect size only in 12%. But conversely, if I conduct a poor meta-analysis, I will have this completely useless. And if this is completely useless, I cannot, I mean, I could perform a new meta-analysis using this 10 and avoiding this one, excluding this one, and probably the results could be not so different. But if the whole meta-analysis is poorly conducted, you should throw to the trash all the paper, all the meta-analysis. So the importance of having a well-conducted analysis is much more important than conducting a good randomized control trial. Let's try to do everything well done, no? But there's no solution to a poor meta-analysis, and the solution to a poor randomized control trial included in the meta-analysis. But the other thing about the utility or the useless of an analysis is how the research question was performed. It's very typical to see research questions not correctly performed. For instance, not comparing all the treatments in given condition. So if I compare just one group with another group and skip a third group, this will probably not be relevant, because it would be much more important comparing the three of them. Or, for instance, something very typical, grouping the interventions in non-consistent groups, saying, for instance, all the NSAIDs. Well, not all the NSAIDs are equal, so should not be grouped as one intervention using an NSAID. Or, for instance, using complex interventions poorly described and creating groups of poorly described complex interventions, typical in adherence, for instance. So there are many aspects that you can consider a poor meta-analysis. I have another question here from Elida Zairina. And she asked if it's mandatory to register the protocol in Prospero, and what happens what are the consequences if we don't register in Prospero. Well, let me start from the second one. And there's some journals that will not accept a meta-analysis or a systematic review if it's not previously registered. So the consequences could be difficulty in publishing the paper. That's the first one. Why we need to register the meta-analysis? Exactly the same that we need, the same reason that we need to register a randomized control trial: transparency. We are trying to avoid publication bias. Let's think of something. I want to make a systematic review, a meta-analysis about a group of medicines. I perform that systematic review. And if the results are not those that I expected, I just don't publish that systematic review. That's bias in the science. So that's why you should always register your meta-analysis, systematic review, before starting the conduct. And that's why journals do not publish if it was not registered before starting the conduct. I strongly recommend. The problem we have is that Prospero is accepting only meta-analysis with interventions assessing outcomes on patients. So if you want to register a meta-analysis about something that is not assessing an outcome, they will not register that. Not because it's a poor meta-analysis, it's because they are not interested in that type of meta-analysis. In my opinion, they should accept all kinds of meta-analysis to register and make their opinion based only on the quality of the protocol of the meta-analysis. I have some more questions here recorded. Mustafa Mohamed, and also Sindra Junior, both ask about the preprints. And I want to state very clearly my position in preprints. They should not exist. That's my position about preprints. They should not exist. Why? Because it's, again, a tricky way of avoiding the mechanisms of control that we created, and can be wrong. Okay, let's modify these mechanisms of control. But remember, one of the biggest problems in COVID was produced by one of these preprints. It's a lot of people that was intoxicated and a lot of money wasted with hydroxychloroquine. And that came out from an absolutely wrong preprint published in one of these preprint servers. I don't want preprints. I don't use preprints in my meta-analysis. Why? For several reasons. First of all, because of this reason that I mentioned. But second one, let's imagine that a preprint, which by definition has not been peer-reviewed, is then corrected. A year later, someone corrects that preprint and changes something in that preprint. But if you have used the original preprint in your meta-analysis, your meta-analysis is wrong. So you have to retract your meta-analysis. That's the risk of using preprints in a meta-analysis. If the preprint is modified, you have to withdraw or you have to retract your meta-analysis. So I will never use, and the sentence is very clear, I will never use a preprint in one of my evidence systems synthesis exercises. Some more questions.
We have another question here, Professor, on Mohammed, about low quality studies.
Yes, I have.
The best practice on how to deal with it.
Okay, this is very controversial, Mohammed. This is very controversial. Cochrane insisted, and I agree with that we should not exclude the low quality studies. We should not exclude them unless we know that it's completely wrong. I mean, this is wrong, not a low quality. This is a wrong study. They made a mistake in the calculations. That's completely wrong. I would accept excluding that study. But if it's a not wrong study, that is low quality with some biases that you can assess with the risk of biased instrument or with any other instrument to assess the quality of the study, I would recommend not excluding for the main meta-analysis, but as recommended for several things in meta-analysis, performing a sensitivity analysis. And this is very simple. Perform the meta-analysis with all the studies, and then repeat the meta-analysis only with those that are no low quality studies. If the difference is crucial, you have a problem. I cannot say that you should do one or the other. You should report that you have a problem. So at that point, I would say there's not sufficient evidence about the topic. And that's something that we should be accustomed to report, that the evidence is not clear or is controversial. Because if the direction of the effect size changes from using all to using only the high quality studies, you've got a problem. It's not clear. So it's not correct excluding them, but it's not correct ignoring that situation. And when you're talking about a systematic review, so you don't have a meta-analysis, you don't have an effect size, you should in your conclusions state what is the difference between the high quality papers and the non-high quality papers. If there's a big difference in what they report in the systematic review, should also be mentioned in the conclusion.
So let's just go for the last two questions. Then we have the networking event.
Okay.
One of them is from Samsa on Kenya. She asked, what's the difference between systematic review and literature review? Is there any?
That's a very good question. And it's a huge mistake very frequently existing, considering that something is a systematic review when it's not. Well, there are several aspects of a systematic review that define that as a systematic review. The first thing should be systematically performed. It's obvious. No, it's not so obvious. When you are talking about a review, a traditional review, what we call a narrative review, you are talking about a review that is trying to compile, to combine what you find about a specific topic. So it's a kind of setting the state of the art about a topic, searching for literature about that topic. You can do that in a half systematic approach, in a partially systematic approach, which is recommended, but it's not a systematical process to select the literature that you're going to include in your synthesis. So you include what you think you should include to clarify what is the state of the art. I'm talking about narrative reviews. When you are talking about systematic reviews, the first thing that you have to have in a systematic review is a research question. If you don't have a research question clearly stated with one of these acronyms that Fernanda showed you, typically with a PICO, but anyone can be used. If you don't have that, you don't have a systematic review, first thing. The second thing, there's 6 steps, about 6 steps in the conducting of a systematic review. All of them have to be systematically performed. So you create the research question in a systematically way. You create such a strategy in a systematic way. You select the literature that you want to include in a systematical way. You extract the literature in a systematic way, and then you synthesize the literature in a systematic way. If you ignore one of these systematic that I said, your systematic review will not be a real systematic review, or will be a poor systematic review. That's the difference between a narrative review and a systematic review. I hope
Yeah. The last question is from Mustafa. He asked what the minimum bibliographic database need for the systematic review, looking at the limitation of subscription access in research limited settings.
I'm coming back now to my PhD some years ago, many years ago. That was my research in my PhD many years ago. Okay, I would say something. First, an error. A typical error is thinking that we have to include a lot of databases. Not necessary. Not necessarily a lot of databases, especially because what we call overlapping in databases. So for instance, in our area, we are talking about biomedical sciences, pharmacy, all these areas, you for sure have to use PubMed. Necessary. You have to use PubMed. It could be a good idea, but it depends on your university agreements, that you could use also Scopus. Could be a good idea. And I said, if you use these 2 databases, you don't need any more. Because what you are going to achieve, what you're going to obtain or retrieve using other databases, if you perform a good search in these 2 databases, would be irrelevant. You can use also Web of Science, you can use also Cielo, Directory of Open Access Journals, you have a lot of them. If you can use always PubMed, that's necessary. And if you can use PubMed and Scopus, that would be enough. What's the other option? You have Directory of Open Access Journals, which is also for free, so you can use it. And you can use the Cielo, which is also for free, so you can use it. So if you cannot go to Scopus, if you cannot use Scopus, you have 3 databases for free: PubMed, Directory of Open Access Journals, and Cielo, which are completely for free, and you should try to use the 3. But try to convince your university to use Scopus. If you use PubMed and Scopus, you have everything with you.
Thank you very much, Fernando, once again for being here today, for this enlightening presentation, and for answering all the questions. So let's move on for the networking event. So I know that it's difficult because it's not a face-to-face event, but we can now open the room for further discussion, and you can discuss a little bit about your project. So for the networking event, just again to remember you can join our Facebook group, or you can share international network, gain knowledge, pharmacy practice, research, share ideas and publications. So please do. And I just put here some questions that I want you to share with us. If you think that this workshop was useful in any way for your research. So for those that are performing a systematic review and meta-analysis at this moment, what is the topic about? Do you need any help? So please, if anyone wants to talk a little bit about your research, feel free to do it. I see that Rosetta already shared with us on the chat box one published article, recent published article. I don't know if you want to speak a little bit about it, Rosetta.
Hello.
Hi.
Hello. Can you hear me?
Yes.
Yes.
Okay. So my name is Rosetta. I'm a PhD student at the University of Hertfordshire. And recently, I, together with my supervisors, published an article, Medicines-Related Problems in Frail Older People Originating in Primary Care Setting in Older Adults. It was a systematic review. So what this article did was pull together studies from different authors, comprising of different study methodologies, and trying to get together things on medicines-related problems, interventions used to combat medicines-related problems, and the outcome of using those interventions in order to stop people deteriorating from medicines. So that's the summary of the study. And this study has been published. And if you go to this thing I gave you, the link that I gave you, you'll be able to read it on there. So it was published online yesterday.
Congratulations.
Yeah, thank you very much. We're very pleased with that.
And this was your first systematic review, or have you performed? Yeah, it was your first.
It's my first one, yeah.
Okay,
yeah.
So double congratulations.
Thank you very much. Thank you.
So anyone else wants to share the research or some thoughts about the systematic reviews and meta-analysis on your field or on your faculty? I think it's important this kind of networking because we have some projects. For example, here I work in Brazil in the Faculty of Pharmaceutical Sciences in the Federal University of Paraná. And as you saw in the presentations, we do a lot of work both on the pharmaceutical research, so on pharmacies-led systematic reviews, but also we do a lot of research on research methods or network meta-analysis. This is a different kind of meta-analysis. It's a promising tool also, and on different types of intervention, but in my field is most related to drugs intervention.
Yeah, okay. At the moment, I'm working on the second study actually, which is a retrospective cohort study. So I'm currently preparing a manuscript on that. Okay. So I don't know. Yeah, and I hope to send out to a journal as well, to see if it can get published.
This is a different type of study design, but it's also really important, as Fernando already showed us in the presentation. Yeah. If you want to discuss more, please feel free to also send us some emails or join the Facebook group. If you have further questions on the presentations for Fernando or for me, also feel free to do it.
Oh, thank you. Thank you very much. Yeah.
So let me ask, anyone is currently performing or starting the protocol or systematic review? Anyone is at initial stages that we can help? I don't know if we can help, but we can try to help. That's the idea of a networking event like this. Is anyone preparing a systematic review or starting a systematic review?
Maybe also most of you are interested in this workshop to learn a little bit more about the Prisma. So for the next steps of your research, we hope we have helped you with that. But I think it's important for you to deeply read the material from the Prisma. So the explanation, the documents, and to understand all this flow that we try to put in 1 hour presentation.
Thank you.
So we have a couple of 5 minutes. If you want to ask other questions, feel free to do it. Otherwise, we can do a break before entering the main room again for the next section.
Yeah, you switch the camera on. Is that for to talk? Pia? Okay. No. Just question. Just a question.
I don't have a question. No, thank you.
Okay. Oh, no, okay. No worries.
I was just interested in the new Prisma statement or methodology, and that's why I'm here. I'm not starting a review right now.
Okay. I have to say that I have a dual position with the new Prisma. It's better than the other one. It's better. I have to say that it's better than the other one. But in my opinion, was a missed opportunity to do something really good. So if we are moving on the old Prisma to a new one, it would be a golden opportunity to produce a really good Prisma. And in my opinion, it's not a really good Prisma. It's better than the other one. I have to say that. It's better than the old. But it's not the Prisma that I would like to have today.
What is lacking in this new one?
So say?
What is lacking in, what did you say is lacking in this new one?
More precision in what you need. So I want to say exactly what is required, and it's not.
Okay.
It's better than the other one. The other one was too good intentions, try to present those things. This is a bit more straightforward, but should be absolutely, is that yes or not, but every single item. Because if we, for a while, educate the people to what's absolutely required, in 10 years, we have a lot of good meta-analysis. And it's some open statements in there that you can escape from that.
Okay.
We have here another question from Mohammed again. So what about the systematic scoping review?
Well, systematic scoping reviews are really good study designs because they produce a systematic map of a concept. That's what we call concept map. That when we talk about the concept map, you don't have to depict that kind of bubbles. You can depict in bubbles the concept, but a concept map could be a checklist of elements constituting something. So let's imagine that we make a scoping review. I'm inventing this to check all the components influencing non-adherence. So we make a checklist. We don't have to make the bubbles depicting it. We can do that, but we don't have to. We can make a checklist with all the elements ordered and classified and all these factors that influence. So this is a systematic scoping review. Which is the problem with the scoping reviews now? That all those poor systematic reviews are being classified as scoping reviews. And it's not intended to do that. I mean, systematic scoping reviews are very important pieces of research. Don't name scoping reviews to those poor systematic reviews. That's not correct. Poor systematic review are poor systematic reviews. That should be in the title. This is a poor systematic review. So don't name us as a scoping review.
Well, thank you very much once again. I don't know if you want Professor to do one wrap up and conclusions, and then we can go to the other room again.
Well, thank you, Fernanda, for this opportunity. My wrap up should be systematic reviews, as you saw in the pyramid, are the top of the research. So should not be performed as something in a rush, should not be performed by someone that does not have a deep insight into the topic that a systematic review is about at the top of the evidence. And think of something, guidelines are grounded on systematic reviews. So we are going to change the guideline on treating diabetes because of a systematic review. And that's very serious. So my recommendation is try to think that this is a topic. This is also a topic that requires a team. You cannot do alone a systematic review. A couple of you cannot do alone a systematic review, should be performed by a team. And there are different expertises in this team. So the one who creates the search strategy is different from the one who extracts, or the one who makes the statistics. So there are different expertise. It's a complex process, and it's not something that should be performed in a rush. So that should be my wrap up. And I invite you to join to this area of research. It's amazing. I love it. I recommend you to enter in, but do not enter as a quickie. Not enter because you like it and you want it, and you love it. That should be my wrap up.
Thank you once again very much. People are asking for our emails. I don't know if you want to share on the chat box, please, Professor.
My email?
Yes,
so,
I think, yes.
Sure. Look, here it is.
If they need anything else, they can contact us.
Sure. And I hope we can see and we can meet together next year in Lausanne or wherever in the world. We can travel safe and shake hands. That's something I miss. I want to shake hands.
See faces, shake hands. And so thank you all for participating on this workshop. I hope that you enjoy it and you take a message from here. Again, you can contact us for further information. And we are going back now to the main room.
So sorry, Fernanda, there's a question from Khalid about where's the link of the record of this. I think they're going to be shared in the Facebook.
It's going to be shared on the Facebook, so in our Facebook group, and also on the FIP website. So enter on the FIP website, they will have the last events. Ours is the last one this week, so we will be available there. Okay. So we can leave from this room and we are going back to the main room. In around 5 to 7 minutes, we are going to the next section on the other room. So you can also drink some water, stretch your legs. And it's just clicking on the bottom, the blue button on your screen that says leave room, okay? Once again, thank you very much and hope to see you soon again.
A pleasure. Thank you. Thank you all.
Thank you.
Thank you.
So for those that are still here in this room, please, you can leave and go back to the main room. In a couple of minutes, we will start on the main room, the next section. So in about 5 to 7 minutes. So I will close this section and we are going back to the main room. Once again, thank you.
Hello, everybody. We're just waiting for people to get back out. The breakout rooms will be closed in a minute, and then they will all come back in here, and we can do the closing. Who's sharing the screen now? Can I share the screen? I don't know who's sharing the screen. Victoria, is it you?
No.
No. Fernanda, no. Oh, it might be headquarters. Ah, perfect. Thank you. So do you see my presentation in full now?
Yes.
Yes, we can see.
Perfect. Thank you. I think we will proceed now. They are invited into the group now, I can see, and people are starting to get back in. So we will start the closing of this event. I hope you have enjoyed yourself. This is just to show that we have basically been all over the world. It was very obvious this morning when we all signed in, and there was hellos from all over the world. But also it was good to see that that when we had the presentations, we were also traveling from place to place all the time. So for the closing, we will just say it was nice seeing you all. It was really great. And then we have some information for you. First of all, of course, not to any surprise, I would once again advertise for the Facebook group. And it's just because that the network is so very crucial and very important for all of us during these times. And when we are only able to meet online, we should also use the online networking ability or possibilities. And this Facebook group is one of the possibilities for this particular group. We have more than 3,000 members. So if you reach out to this group, you'll actually have access to 3,000 researchers from all over the world. And there's probably someone out there that has the same interests for you as you have. We will do, based on the different workshops, we'll do small reports on what was in there. So for the rest of you to see what has been produced, but also to share with the rest of this research community. And now comes the very, very important part of this closing ceremony, namely the prizes. So I'm happy now to announce the winners of the Professor Oreo Award, like Victoria said in the opening of the session or this event today. We had the opportunity to give this award, and we will name this award onwards in respect because we miss, and he has shown so much for us, Olivier Bougnon, over the years. Coming up to this conference, we wrote his family and his son, which is also a pharmacist, and told them that we wanted to do this award. And he said that this would be so nice for Olivier because he was actually very engaged in motivating the research among young researchers and senior researchers in this area, and pharmacy practice was always close at heart to him. So let's give him a thought. So the winner of the Olivier Bougnon Award, the first Olivier Bougnon Award, is Denise Hope from Australia with her presentation on gamification. So let's clap or whatever we do. We will make certificates for you that will be sent after. And then we also have the runners, so the running up, so the second prize, and that goes to Matthew DeMarco from Canada on his scoping review on pharmacy technician and their roles in immunization. So congratulations to both of you. We'd like to thank you once again for all the very good abstracts. We had a hard work finding the 20 and even harder work to find the 2. So thank you, everybody, and thank you for sharing your research. I'm sure that this is relevant for all of us, and we all take some 1 or 2 ideas home that we can use in our future work. Thank you very much. And now I will give the word to YPG, the Young Pharmacist Group, and the Professional Innovation Grant that they manage. Can somebody from the YPG open their mic and take it from here? I'll do the slides forward. Thank you. Philippa was unfortunately, she had to go, so I think someone else would take over from her.
Good day to everyone. I'm Abubakar Usman, and I will take over from Philippa.
Thank you.
All right, thank you so much. So basically here I will be discussing about the FIP-YPG Professional Innovation Grants. And for the start, I would like to mention the goal of the project of the Professional Innovation Grants. And the goal of the Professional Innovation Grant is to support innovation or promote innovation among young pharmacists as well as young pharmaceutical scientists. Such innovations should be innovations that will address either local or global health issues that could advance pharmacy profession, promote or improve the quality of pharmaceutical services that are rendered to patients. Next slide. So usually every year we actually award a grant. We award the grant every year. But unfortunately, in the last 2 years, we've not been able to do so due to the COVID pandemic. But hopefully next year, in the first quarter of the year, the application is going to open. And for the one important thing we actually stress is that each of the projects that is our proposal that is being submitted should have a positive impact on the community, as well as has a direct clinical impact, our application. Each year, like I mentioned earlier, like I said, the project should have, there are 2 criteria that we look for, 2 issues that we pay attention to. The first one is that the project should have a positive impact on the community. The second, it should have a direct clinical application. This is something we do pay so much attention to when we review the proposals that have been submitted. Next slide. So in every year, the winner will be announced after the proposals have been reviewed, and the winner of the awardee will receive a grant of 1,000 euros to assist with the implementation of the projects. A year after, we expect the awardee to submit a project report to the FIP Foundation for Educational Research, and the winner will then be entitled to a complimentary registration and a return ticket, as well as accommodation to attend the FIP Annual Congress. So at the Congress, the awardee or the winner of the award is expected to present the findings of the projects in a poster format. Next slide. So the next issue I will talk about is the eligibility of the applicants. For you to be eligible as an applicant, you must be a member of FIP, YPG. So you must be a member of the Young Pharmacist Group. And usually for applications, we expect each applicant to submit only 1 proposal on his or her name. Group work, we encourage people to work in a team, but group work should be submitted under the name of 1 person. For previous winners of the award, they are not allowed to apply again. In addition, we focus on projects, we encourage applicants to focus on projects that could be completed within 1 year. And do not encourage applicants to take up additional fundings from other bodies to support the project that has been awarded. Next slide. So we value the importance of mentorship, because we know mentorship is important in building research competence among young pharmacists as well as young pharmaceutical scientists. So we actually have a program, a mentorship program, where we encourage each applicant to identify a mentor who could help them to design as well as conduct the project that they are submitting. So in view of this, the applicants are required to identify a research mentor who will assist them to conduct the research. For applicants who could not or who cannot identify a mentor, we don't, there's no problem about that. We encourage you to send us an email at ypginnovationgrant@fipinnovationgrant@fip.org. So once we receive your email, we will help you to identify a mentor that will assist you with the writing of the proposal as well as conducting the research when it is awarded. Next slide. So the next issue is the judging process. After the proposals have been submitted, we actually have a panel will be constituted, and this panel will be nominated by the FIP Young Pharmacists Group Steering Committee, and this panel has to be approved by the FIP Foundation. So the panel will then review all the proposals that have been submitted, and for these, we have about 5 criteria that we use to review the proposal before the winner will eventually emerge. Next issue on the slide. All right. For the criteria that we use, we have 5 criteria, like I mentioned earlier. We look forward to the significance as well as the relevance of the project that is being submitted. For this, we have a weightage of 25 points that is awarded to this. The next issue is the creativity and innovation of the projects. We have 20 points for the scientific accuracy has 20 points. Clarity of communication has 15 points. Feasibility and skill has 20 points. For feasibility, we look forward to projects that could be completed within 1 year. And this is very important when we review the proposals. Next slide.
That's it for you. So thank you. Do you have?
All right. So like I mentioned earlier, at we will open the applications for the grants in the first quarter of 2022. And for prospective or interested applicants, please, you can start writing your proposal, focusing on the project that have impact on the community as well as have a direct clinical application. We hope to see you next year in the Congress. Thank you.
Thank you very much. And I promise you, we hope to see you too. We hope that we will be able to see each other in Seville next year.
All right, thank you so much.
Thank you. And I hope also that we actually have, do you have any closing remarks?
I thought you have a question.
Are there any questions? No.
All right, thank you so much.
Thank you. So we hope to see each other at the Seville event and then after, but we as researchers hope to see you soon, sooner, because we hope to see each other already in Lausanne. If you go to the web, you can find this event, the Pharmacy Practice Research event. It was supposed to be a summer meeting, that's why it's called Lausanne 2020. It will be in January 2022 from the 24th to the 26th, and we'll have a physical meeting similar to this. Of course, we will have much more time for networking. We will have much more time for plenary sessions and much more time for both longer and shorter presentations. And we will also have a poster gallery like we had at the summer meeting in Lisbon a few years back. So we hope that you will register. We have 160 registrants from last year, and we will of course approach all of them and then hope, of course, that many of you will come. So everything is on the website, how to approach. And I hope to see you in person, or we hope to see you in person in the next meeting in Lausanne in January. And that is pretty much it from us. We like to thank you for being in this meeting. It was great having you. It's the first time we have a meeting like this, and it was really nice to see you all. And if there's any closing remarks or comments, please feel free to share them with your colleagues. Just turn on your mic or write in your chat.
Charlotte,
Yes.
Can I just ask, do you have an idea what would be like the format for the winter meeting? Roughly.
Rough format, actually the program is in there. So it will be a mixture of plenary sessions. Then we'll have workshops, but that will be half-day workshops. So we'll have like 3 hours to work on a specific topic. And then we will have 3 minutes presentations and poster views. So that's pretty much the format. It's very important what we learned in Lisbon a few years back. It's very good and very useful for many of us to see a lot of projects introduced and then to be able to go down and see the poster afterwards. And we will try to do something similar in the Lausanne meeting. Hope to see you there, Suzette. Any other comments on the closing? Does not seem like it. Then I would just like to say, maybe Victoria and Fernanda has something to say. I'll just like to say it's been great having you. This was a trial and you proved that it is possible in these strange times to actually meet and talk validly about research. Thank you very much for that.
Yes. Likewise, I would like to thank all our attendees. We hope that you really enjoyed the event. As Charlotte was saying, this was the first time we've run a virtual event like this, so it was a bit of a trial. So hopefully we will be able to see you face to face in Lisbon. Keep an eye because you can still submit your abstract. It will be open until November 2021, so we would love to have you there. And I would also like to thank the FIP events team for all their support during the organization of the event, and also to the BPS for their support as well. So thank you very much, and we hope you enjoy the session.
Thank you.
Thank you all for participating.